Buenos días, buenas tardes. Muchas gracias por estar aquí con nosotros. My name is Hector Sanchez, and I'm the Executive Director of the Labor Council for Latin American Advancement, LACLA, and the Chair of the National Hispanic Leadership Agenda. The National Hispanic Leadership Agenda is the most important Latino coalition in the nation, where you have 36 national organizations coming together to talk about the priorities of the Latino community. We come together to discuss those priorities, to analyze those priorities, and then we have a public policy agenda that offers recommendations to both parties, to Congress, to the President, and those are the recommendations that we have on behalf of the Latino community in the nation. For a very long time, we've been advocating and working on the issue of healthcare. This has been a top priority for the coalition. And as the President reminded the nation this morning, the Affordable Care Act is about offering millions of Americans the healthcare security they deserve. This means affordable health insurance options for the uninsured and better benefits for those who already are insured. For the Latino community, it is not exaggeration to say that the opportunity presented by the Affordable Care Act is both historical and monumental. For far too long, the health status of the Latino community has lagged behind most of the rest of the nation. Our brothers and sisters, our parents, and our children suffer from higher rates of chronic diseases. And for far too long, far too many Latinos have lived without any health insurance coverage at all. No doctor to go to for preventive treatment, no other option to ignore a condition until it was so bad to require an emergency route to visit, with all of the lost productivity, poor health outcomes, and family stress that come with such a condition. That's why this issue is so critical and important for the coalition and for the Latino community. For over 10 million Latinos, that situation has no longer to be the case. Now, thanks to the Affordable Care Act, over 10 million Latinos will have access to affordable health insurance options through the health insurance marketplaces. The opportunity to insure 10 million Latinos and close the gap in health disparities is an opportunity that the National Hispanic Leadership Agenda and its member organizations are seizing, and seizing with the energy that this task requires. While we're kicking off a National Hispanic Health Week of Action, our efforts will continue well beyond this week as we work to enroll every eligible uninsured Latina and Latino into health coverage. I'm pleased to introduce several of the leaders of our member organizations, as well as friends and partners of NHLA who are all working shoulder to shoulder on the ground in the community, online and through our social media, to seize this historic opportunity to improve Latino health. But before I introduce our colleagues and friends and leaders, I'm going to say a couple of words in Spanish. Esta mañana, el presidente le recordó a la nación que la ley del cuidado de salud a bajo precio es acerca de ofrecer un seguro de salud para todos los estadounidenses. Esto significa tener opciones accesibles de seguro médico para todos aquellos que no estén asegurados y la misma vez mejores beneficios para los que ya tienen su seguro. Para la comunidad latina no es una exageración el decir que la oportunidad presentada por esta ley es histórica y es monumental. Durante demasiado tiempo, el estado de salud en que se encuentra la comunidad latina se ha mantenido rezagada en comparación con el resto de las poblaciones en el país. Nuestras hermanas y hermanos, nuestros padres y nuestros hijos padecen de las tasas más altas de enfermedades crónicas y desde nuestro punto de vista esto es inaceptable. Durante demasiado tiempo, demasiados latinos han vivido completamente sin ningún tipo de seguro médico o sin un doctor en particular para tratamiento preventivo. La única opción es ignorar la enfermedad hasta que ésta se convierta demasiado grave para que requiera una visita a la sala de emergencias y con esto la pérdida de productividad, un estado de salud deplorable y un inevitable estrés familiar. Para más de 10 millones de latinos, esta situación está a punto de cambiar. Gracias a esta ley del cuidado de salud, más de 10 millones de latinos tendrán acceso a opciones de seguro médico accesibles a través de este mercado que se está poniendo en lugar del cual vamos a tener acceso, ya tenemos acceso. 10 millones de personas, esto equivale a una población más grande que varios estados en el país, y esto también representa la oportunidad de asegurar a 10 millones de latinos, cerrar esta brecha en las disparidades de salud. Es una oportunidad que esta coalición es crítica, y que vamos a tomar el liderazgo y la bandera para asegurarnos que toda nuestra estructura en el país está en el lugar adecuado para ayudar a todas aquellas gentes en todos los estados a que tomen ventaja de estas nuevas oportunidades. Hoy tenemos la fortuna de tener presente grandes líderes de nuestra comunidad, y vamos a escuchar también de ellos. Vamos a empezar con la doctora Elena Rios. I'm going to introduce Dr. Elena Rios. She's the president and CEO of the National Hispanic Medical Association, and she's the chair of NHLA's Health Policy Committee. Doctora.
Thank you, Hector. It's a great honor to be here. The National Hispanic Medical Association just finished 6 roundtables around the country, from Los Angeles to Chicago, San Antonio, New York, Washington, D.C., and Atlanta. And we have regions now of steering committee members and doctors ready to answer questions for our community and to work with the NHLA organizations out in the regions of the United States, where the 10 million Latinos are present. We are everywhere. The Latino, especially the Latino youth, need to get the message that our families have so much diabetes, cancer, hypertension, cardiac problems like cardiac heart failure, HIV, AIDS, obesity. We have so many diseases in our family that run in families, and that our next generation of youth, the 20-year-olds, the 30-year-olds, are bound to get these diseases. And that's why it's so important. And I'll just want to emphasize the importance of why we need health insurance for the 10 million who are eligible right now to have affordable health insurance. Why do we need it? Because healthcare is so expensive. Thousands of dollars just for staying one day in a hospital. And that doesn't count the thousands of dollars that you have to take medication for the rest of your life once you have diabetes or high blood pressure. So it's so important to consider going to the healthcare.gov website. And the phone number, let me just give you that phone number, is area code 800-318-2596. And we know that there will be more speakers up here talking about details. There's lots of options for individuals and for families to get health insurance, and for small businesses. And so many of our Latinos are in these categories, and they need to take a time out and educate themselves and their families and work with our promotoras and all of our organizations to help you get enrolled. Thank you very much.
Gracias, doctora. We're going to hear from a great friend and a great advocate for our community, Janet Murguia. She's the president and CEO of the National Council of La Raza, NCLR.
Okay, good afternoon, everybody. Thank you so much. I'm pleased to be here with these wonderful leaders, very distinguished leaders representing sister organizations, and really kick off a great educational process as it relates to healthcare and access to healthcare and access to what we know as the Affordable Care Act, and really use this week to start this campaign directed at the Latino community, to our Hispanic community. And we want to make sure that the Affordable Care Act reaches as many members of our Latino community as possible. As an organization that represents the most underinsured community in the country, NCLR has long advocated for greater and better access to health care for all Americans. And it is why we became deeply involved in the fight to enact the Affordable Care Act. While it is not a perfect bill, and it has not been a perfect system, it is the first meaningful effort in nearly 50 years to address the long-standing national health care gap, and to be, at long last, bring the opportunity for quality health care to more than 10 million Latinos in the U.S. You've heard that figure of 10 million. It is a significant figure and one that would go a long way to make sure that our families are being covered with such necessary health care at such an important time. The value of health insurance goes beyond better health. That we know from our research that we have done and analysis that having access to the basic necessity of good health care improves the lives of people overall. It provides greater financial and social stability, and for children, it improves their educational prospects and their chances for success later on in life. What better investment should we be committed to than to making sure that our community has access to this health care and that this law is successful? In short, health care is a critical building block for better lives for our community. So since the enactment of the Affordable Care Act, we have worked with the administration and the relevant agencies to make sure the tools and information necessary are in place so that we can enroll as many of these 10 million plus people as possible. Our work continues as we look at this week. NCLR is launching our own outreach and education campaign on the Affordable Care Act. We will be working primarily through our network of affiliates. These are community-based organizations that serve millions of Latinos every day, nearly 300 community-based organizations in 41 states, including the District of Columbia and Puerto Rico. And these affiliates represent some of the largest and most effective healthcare providers to our community and the nation. In fact, 1 of every 2 of our affiliates is involved in health-related work. These are the organizations on the front lines in our community, and they are the best possible vehicles to reach Hispanics and Latino families in this country. As such, we have developed a curriculum and other informational materials for many lay health educators, promotoras de salud, who will work with these community-based organizations. We will also be holding community forums and online webinars. We will be going to various events and conferences at the state and local level to talk about the Affordable Care Act, and we will be working closely with the media, especially the Spanish language and Hispanic media, to spread the word on where to go and what people need to do to access health insurance under the Affordable Care Act. I need to note, though, that we are very concerned and have been making those concerns known about the issues the exchange website has experienced so far, and whether or not people are truly able to enroll as quickly and as easily as we would have hoped. That is why those of us who were at the White House this morning, we're glad to hear that the President is making these issues a top priority and that the administration is taking some key steps toward a solution. Our message is clear. Right now we need to focus on making that work. But I want to share also the President's message that we heard today, and I think it's one that's extremely relevant to our community right now, and that is that we have other options also. And one of those options becomes the call-in line, where people have had great success so far, and there are multilingual speakers who speak in many different languages, including Spanish, and we are encouraging our community to use all options available to them, including the 1-800 number line, 1-800-318-2596. That becomes increasingly important until the website is fully functioning. And for us, our approach at NCLR in particular has been to look at other models of success. When our families have been in trouble with foreclosure, or when we've tried to encourage them to learn about buying homes, we have taken a long-term approach to this, and we understand that there's many elements to their educational process. The same should be said about their approach to buying healthcare. It can be complicated. We have resources within our own organizations and individuals on the ground and back here in Washington who can be available to help walk our community through the full educational process that's going to be necessary. So yes, it's disappointing that we're having these challenges with the website, but right now people can use a call-in number and get access to the information they need to start purchasing, looking at what options they have available for different healthcare insurance options. And they can talk to people, health promoters, promotoras de salud, who will be available more and more to try to help walk them through whatever questions they may have. This can be a confusing process. So for us, October 1 was an important date, there's no question, But what is the most important date is March 31st. We have between now and March 31st to make sure that we are doing everything we possibly can to make sure our community and those who are eligible in our community sign up. So we want to make sure that we are mobilizing every opportunity we can and using the strength and leverage of each of these organizations to make sure that our community is informed. And we plan to do that, and we are very excited to make sure that that process is getting started today. So I want to commend my fellow community organization leaders and national leaders, because we must make sure that we use this window of opportunity and that we have success. The success of this Affordable Care Act, because of the proportionality of our Latino families who are eligible, is intricately tied to the success of our community being enrolled. And we are here prepared, ready to be successful. Gracias. Thank you.
Muchas gracias, Janet. Now we're going to hear from the Vice Chair of the National Hispanic Leadership Agenda of this coalition and the Executive Director of the League of United Latin American Citizens, LULAC, Brent Wilkes.
Thank you, Hector. It's a great day to be with my colleagues to announce our efforts to make sure that we get out the word to our community about the opportunities that are now available through the exchange, through the Spanish language website, and through the efforts of our organizations to help make sure that our community gets enrolled. You know, we knew going into this 3 years ago, really, when we were working on passing the Affordable Care Act, that no community had more to gain from the passage of the Affordable Care Act. Still to this day, 1/3 of the Latino population is without insurance, that $10 million figure that Janet mentioned. The number of children, the percentage is even higher. About half of all Hispanic children lack access to health care insurance. That's just way too much. And that was why we were such a strong coalition, united together, under a campaign we called Latinos United for Healthcare Reform. And we worked really hard throughout the year to try to get the healthcare plan passed by Congress. And 3 years ago, this was not a sure thing at all. In fact, if you remember, the midterm elections resulted in a new Congress that was not disposed towards passing the Affordable Care Act. And it was only because the Senate had already passed their version of it and that the House passed the exact same thing that we were actually able to get the Affordable Care Act into law. Because of that, now our community has an opportunity to get covered. And that's really important. And so the campaign continues. It wasn't just to get the bill passed. Now we got to make sure that our community benefits. And there's a big danger for Latinos. When you look back to the S-CHIP program for health care coverage for children, the Latino community was very slow to sign up for that, even though, again, Latino children stood the most to gain from that bill. In fact, it took about 8 years to finally get the word out sufficiently where we got to the numbers that we were expecting for Latinos to sign up for that program. We can't wait 8 years for Latinos to get access to the Affordable Care Act. We cannot do that. We've got to do a better job this time. And one of the things I think that's really amazing is that right away, last time HHS waited quite a long time to finally come up with a Spanish language website about the S-CHIP program. But right away, within really just the first month of the opening of the exchange, we now have cuidadodesalud.org, which is available for Latinos to go to and get information about the Affordable Care Act. And of course now the bilingual hotline, I want to read that number again because it's really important, 800-318-2596. That's now available right now to help sign people up. And the campaign that the National Hispanic Leadership Agenda, all of our organizations are working on to try and educate folks, is also live. You can get access to information about the campaign at latinosunited.org/healthcare. That's our campaign site. We're going to keep pushing forward on that. And each of our organizations are going to be doing individual things. Janet mentioned the work that she's doing with the affiliates. LULAC has been engaged in big town halls. We just had one in Los Angeles where over 16,000 people came to hear about the opportunities in the exchanges. And we're going to do 4 more. We've got Chicago, Puerto Rico, Washington, D.C., and San Antonio lined up for town halls to get information about this. So the community is hungry for information. We've got to do our job and make sure everyone knows about the opportunities. We're not going to let 8 years go by before we get Latinos enrolled. And the glitches that the website has experienced, yes, they're significant. But to be honest with you, a lot of Latinos don't have access to the internet at this point. And the real important thing is that the exchange offers an opportunity. It's right there right now. People can save money, they can get subsidies to help them afford insurance, and they can just call that internet number and get access to it as we speak. Thanks.
Muchas gracias, Brent. We have Maria Teresa Kumar. She's the president and CEO of a great organization, Voto Latino.
Thank you so much, NHLA, for having Voto Latino present. We've been working very closely with all of you on trying to get as many Latinos involved. Voto Latino, we focus on American Latino youth, and we recognize that they're oftentimes not only the ones that need to desperately be enrolled the most. On average, Latinos are roughly 26 years old. Young women that before could not enroll because pregnancy was considered a pre-existing condition, they don't need to wait any longer, they can now enroll. And more importantly, they're also the individuals that oftentimes translate what's happening, these types of policies are happening for their parents and their family. So we're focusing at Voto Latino on how to enroll them quickly with information that they find smartly, and more importantly, that they can go ahead and share and repurpose. Last week we launched a series of webinars with Google, where we are actually providing people with real-time information from leading experts. And we're also working very closely with our coalition of Latino celebrities, bloggers, and radio personalities, because what we find most importantly is that these young people need the information and they need to be able to share it. And there's something that I've realized, that one thing that we haven't discussed enough when it comes to the Affordable Care Act. I have yet to meet a Latino who doesn't like a bargain. And 6 out of 10 eligible folks for insurance are eligible to pay less than $100 a month for their health insurance. That's an incredible cost savings. You spend more on your cell phone bill, I'm sure, or even your cable bill. But this provides preventative care. So the more that we can get this information, and that's why we're really here today, is the more we can get this information, just the nuts and bolts of how easy it is to apply. Yes, there's glitches right now on the website, but you can do it the old-fashioned way. You can go ahead and use your 1-800 number, or you can go ahead and go to another website. It's called localhelp.healthcare.gov. Again, localhelp.healthcare.gov, and they'll help navigate at the local level any information that you may need. And the more, when we start talking about the importance of healthcare coverage for the Latino community, because we're younger, but we're also the vastly most underinsured, we need to make sure that we're having these conversations around the kitchen table to make sure that the window of enrollment is short but critical. Y voy a terminar con una cosa. Más de todo es importante que la comunidad latina nos podemos escribir a la aseguranza de salud. No he conocido jamás un latino que no le gusta una ganga. Y por la mayoría de la gente, 6 de 10 que son elegibles pueden recibir su aseguranza por menos de $100 al mes. Por menos de $100 al mes. Es increíble. Si tienen problemas ahora con el sitio de web, pueden ir a 1-800-318-2596 y van a tener una operadora que pueden hablar con uno en bilingüe. Y está abierto las 24 horas, 7 días a la semana. Y también, si quieren encontrar información local, pueden ir a localhealth.healthcare.org. Eso me asegura que lo van a traducir. Pero muchísimas gracias por estar ustedes con nosotros. A este momento, la prensa, más que todo, necesitan compartir en esta oportunidad para informar a la comunidad, porque sin ustedes no podemos hacer nada. Muchísimas gracias.
Muchas gracias, María Teresa. We have Jose Plaza. He's the National Director of Latino Engagement from Enroll America.
Thank you, Hector. Good afternoon. It is no secret that Latinos are one of the most disadvantaged groups, and with 1 in 3 Latinos lacking health insurance, it reinforces the idea that this is not acceptable. Yet, for the first time ever, millions of Americans, including Latinos, now have access to quality and affordable health insurance. Although there have been numerous problems with healthcare.gov, Spanish speakers can still enroll by phone, 1-800-318-2596, you'll hear it a lot, or in person with an in-person assistor through ayudalocal.cuidadodesalud.gov. That's a Spanish website. Furthermore, we at Enroll America, as a national nonprofit, we are tasked with working throughout the state. We recognize the urgent need within the Latino community and are working tirelessly across the nation, targeting the most critical areas with the help of partners like those here today through our campaign, Get Covered America. Our families, our youth, and our children are too important. By ensuring them, we ensure our future as a formidable nation. I'm going to give some words in Spanish. Buenas tardes. No es ningún secreto que la comunidad latina está enfrentando varios retos. Es inaceptable que 1 de cada 3 latinos no tiene cobertura médica. Pero ahora, por primera vez, millones de americanos tienen acceso a cobertura de calidad a un bajo costo. Aunque la página de internet ha tenido varios problemas y algunos retrasos, estas personas que necesitan ayuda en español tienen varios recursos a su alcance. Personas se pueden inscribir al llamar al 1-800-318-2596 o encontrar ayuda en persona y local al visitar ayudalocal.cuidadodesalud.gov. Nosotros en Enroll America y nuestra campaña Get Covered America estamos cometidos a cambiar estas estadísticas tan negativas afectando a nuestra población. Trabajando con organizaciones nacionales y locales como las que están aquí presentes, hoy tenemos personal en 10 estados, en varias ciudades con números críticos de latinos sin aseguranza. Ahora es el tiempo perfecto. Nuestras familias, nuestra juventud y nuestros niños merecen estar asegurados para el seguro de nuestra nación. Gracias.
Muchas gracias, José. Anne-Marie Benitez, she's the Director of Governmental Relations and Public Affairs for the National Latina Institute for Reproductive Health.
Thank you, Hector, and National NHLA for letting us be part of this really important press conference. Good afternoon. First, let me say that the Affordable Health Care Act is a win for Latinos and Latinas. It will expand access to important reproductive health care services for millions of Latinas, like mammograms, cervical cancer screenings, contraception, and other vital services. By expanding insurance options that are going to be available in the marketplace and easy to look and compare prices. Also, it increases funding for community health centers that many Latinas depend on for care. We know the Affordable Care Act will help Latinas get the care that they need and demand. The National Latina Institute for Reproductive Health believes that health care is a basic human right, and the Affordable Care Act helps us get there. And that is why we are making sure that we are in the community and educating Latinas and Latinos about what is available to them. We're doing that through cafecitos, we're doing it through social media. We're making sure that we reach our community where they are so they know what the benefits they have through the Affordable Care Act. Y ahora, buenas tardes. Primero quiero decir que la Ley de Cuidado de Salud es una victoria para los latinos y las latinas. La ley aumentará el acceso a importantes servicios de salud reproductiva a millones de latinas, como mamografías, exámenes de cáncer cervical, la anticoncepción y otros servicios vitales. Será posible porque habrá más opciones de seguro por el mercado de salud. También aumenta fondos para clínicas, cuales muchas latinas dependen para servicios. Sabemos que la ley va a ayudar a latinas a recibir servicios que necesitan y demandan. El Instituto Nacional de Latinas para Salud Reproductiva creemos que el acceso al cuidado de salud es un derecho humano fundamental y estamos a camino a ser exitoso para llegar a este derecho. Por eso estamos en la comunidad ahorita a educar a nuestra comunidad cómo pueden recibir estos servicios fundamentales. Muchísimas gracias.
Muchas gracias. I thank all the speakers for being here and for all the great work that they are doing on this priority for the community. We're going to open it up for questions in English and in Spanish, and if you want one of the speakers to answer your question, just refer to the speaker.
Hector,
Fernando.
After, if the question can be answered in both languages, I'd appreciate it. So as we all know, as you said, that Hispanics and anybody can enroll the old-fashioned way, which is via paper, form, or online. However, we've known since September, late September, as a matter of fact, the White House itself informed that the Spanish online enrollment website would not be operational until this week.
Mm-hmm.
It would be matching, that was the excuse given by the White House, we would be matching this week of action. Now we already know that that's been postponed. What's your reaction? Are you disappointed that the online tool is not yet active in Spanish?
Obviously, we would love for everything to be available as soon as possible, but we need to remember that this is bigger than a website. if we really take a holistic view at what we're talking about here is the future of an entire community. And one little glitch on a particular website is not going to stop our community from moving forward on these critical issues. So we recognize that there are issues, we recognize that there are problems, but we need to take a look at the bigger picture and how we enroll all of the Latinos, those 10 million Latinos in this important and critical element, te lo voy a decir en español. Es muy importante el asunto que mencionas. Hay un par de problemas en el tema del website, pero tenemos que recordar que esto no es acerca de un website o el internet. El cuidado de salud y esta ley de salud es algo más importante que afecta y beneficia a la comunidad en general. Entonces es importante que no nos distraigamos con estos pequeños detalles. Obviamente nos gustaría que todo fuera perfecto en la implementación, pero tenemos que enfocarnos en la pieza elemental, que es asegurar a toda nuestra gente. Bueno, open it up for some of the other speakers if they want to answer that question. Janet?
¿Usted podría responder esa pregunta ya que estuvo aquí en la Casa Blanca? ¿Está usted decepcionada de que la página web en español que se debió haber iniciado hoy no arranca hoy?
Pues yo pienso que como todos que han criticado el sitio de web, también nosotros estamos frustrados que no está todo listo. Pero es un punto muy importante decir que hay otras opciones para nuestra comunidad. Y mientras tenemos que aprovechar de la línea de teléfono 1-800-318-2596 que pueden usar y hablar con alguien en español. Y también hay locales de websites locales donde pueden conseguir ayuda. Y además de eso, nosotros tenemos que preparar a nuestra comunidad en educarles, porque también empezando el 1 de enero, esperamos ver si va a haber oportunidades de conseguir cobertura sobre el programa de Medicaid, que es un programa de cada estado, y nosotros tenemos que educar a nuestra comunidad. Eso, bueno, nosotros tenemos una responsabilidad, nuestras organizaciones nacionales que tenemos vínculos locales que pueden ayudar en comunicar, y también los medios de comunicación. Entonces, esto sí es algo muy grande y no es todo, nuestra esperanza no puede ser todo en ese sitio de internet. Pero sí es importante, les voy a decir que nosotros queremos que todo se puede solucionar en una manera más pronto que posible. Eso ayudaría mucho, pero hay mucho otro trabajo, muchas otras opciones que debemos de aprovechar para conseguir información y educación a nuestra comunidad. And in English, oh wow, that's a first. I was just saying that we're frustrated like everyone else. I think it's fair to say. The president said he was very frustrated, and we were there this morning, and he was very frustrated. And I think it's fair to say we're just as frustrated that the website isn't ready. But it doesn't mean that we just walk away and tell everybody to wait. We have a lot of work to be done. And there are a lot of other options that can be pursued for our Latino community, especially because it's a complicated system. And we want to be able to make sure that we're using the phone line option where people can call and get information in many languages, including Spanish. And we also want to make sure that we're using all of our resources as national organizations with local outlets to make sure that we're informing our community of potential options. For instance, starting January 1, we're hoping to see states that have the ability to expand their Medicaid coverage and to have our community take advantage of that. That's going to be really important. And a lot of that doesn't necessarily have to happen online. So there are many other opportunities. This date of October 1 is an important date where we started the access to information online, but really it's about enrollment. And it's about all the steps that can be taken for enrollment. And we're very focused on doing everything we can before March 31st. And we have still 5+ long months that we need to make sure we're doing everything we can. And there are other options, and we are going to be pursuing all of them. This is a huge educational campaign for our community because the stakes are high for our community. We stand in the Latino community to benefit from this law if we will work to make it successful. And we're going to do everything we can to make it successful and to make sure our community in particular benefits.
Janet, if I may follow up, as stakeholders or any of you, have you been given any reasons by the White House why the Spanish language website was not ready then and still not today?
Well, I don't know if I have the exact reason, but I have a rationale. And I think it's probably a good one. And the fact is it's not ready. And I think that their rationale now, having seen what's happened on the other website, is let's get it right. And if they're really close to getting it right in Spanish and get it loaded up so that our folks can have a lot of success early on, as soon as they get on, that is the rationale. I have to say I agree with that. Again, I'm not happy about it, and I wish that it would have been ready now, but I agree with their rationale, and when I see that they are learning from what's happening in real time right now, I have to agree. And all I can say is that our hope is that this will get fixed quickly, but once it gets started in Spanish, and that the website in Spanish can be a model for how to get it right, and that we'll see our community actually have even more success than everyone else for those who are eligible. So I have heard that they want to make sure now that they have applied some lessons learned from the mistakes that they've seen so far. I've heard lots of different reasons for why they're not ready, but really our hope is that they will fix it. We got that word today from the president, is that they're going to do everything they can to fix it as quickly as possible. I hope that when they do launch the Spanish language website, we'll see something that will offer our community opportunity to get on and actually see it work for them.
Brent? Hey, Maria Teresa?
I'll jump in real quick because it's just a quick thing. I think it's a danger for us to focus too much on the website. And here's a couple reasons why. Number one, only about 25% of Spanish-speaking Latinos even have an internet connection in their home, and that's not saying they want to use it to sign up for this program. That's why we fought so hard in the law itself to ensure that there were the navigators. And one of our organizations, the Hispanic Federation, received a navigator grant. They'll be making sure that they'll be activating that. There's forms that are available. You don't even have to call in if you want to. You can fill out the forms to do it. But we knew from the very beginning this was going to be a ground game. It wasn't going to be an internet game for our community. It never has been. And that's why we're here together announcing the campaign, working hand in hand to get out the word. And we're going to be doing it the same way we've done it for a long time, which is going from community to community and informing them about the opportunities. Yes, we hope the website gets fixed, but even if it was fixed and working perfectly right now, our job would still be getting the word out to our community, making sure it doesn't take 8 years to get our community signed up for this program, that we do it right away, and that the benefits of the Affordable Care Act really start to visit our communities immediately rather than being delayed. And that was going to be a challenge for us, whether or not the website was working perfectly in the beginning. Once it's up and running, we've got 60 technology centers across the country that will be helping enroll people on the line as well. But even in those centers right now, you can go there, you can call out to the hotline, you can get the forms that are available, and you can sign up through the traditional means that we always have done.
You can download the forms.
Oh, go ahead.
Yeah, that's all. So just very briefly, just to build on that, you can, even if you go to healthcare.gov, you can still download the forms. What doesn't work, unfortunately, is the interactive kayak sort of thing that you do if you were trying to find an airline ticket. The same thing for your health insurance. In that case, it doesn't. But the downloadable forms do work. And I think that what we need to stress is that this is much bigger than whether the website works, but more importantly, how are we working with you, the folks in this room, to ensure that our community has the proper information so that they can take advantage of this. I don't think any of us can stress enough the importance that you, as communicators in the media, will be to make sure that our community has the right information. Because we can do all the work, but you guys disseminate it. So we really look forward to those continued partnerships. Thank you.
More
I
questions?
just have a quick question for you. Are your organizations going to do anything similar to what you did with DACA, and you had these days where you had people actually go and know that on that date they could take their information and try to apply and all of that? Is that kind of what you're looking to do with specific dates around the country?
Gonna allow each one of the organizations, but let me give you the perspective of the coalition quickly. We're building this as we build the rest of the campaigns with all the different elements. We map the capacities of all the Latino organizations that are members of the coalition to see where they are located, where they have chapters, where they have organizations, where they have presence, where they have offices, where they have staff, and we're trying to connect all the work to the ground elements. So it's important. We're going to come up with strategic elements of application of the dates that make sense for connecting it to whatever is happening on the ground with the different festivales, with the different important elements that are happening in states and in independent communities. But let me allow some of the organizations to talk about their independent work.
At Enroll America, that's exactly what we're doing. Like I said, we have staff in 10 different states across the nation. We're hosting every month a National Get the Word Out weekend, where we work in states like Florida, New Jersey, Texas, states with the most critical number of uninsured Latinos. We're having navigators show up to our events. You know, we're working in partnership with LULAC, NHMA, Voto Latino. And so we're making sure that when people show up to these events, not only are they receiving information to take home, but there are also navigators in person that can help them out. If the navigators can't see everyone there, they can make appointments to come back later to provide that assistance both in English and in Spanish. You want in Spanish?
Laura, I just also want to say, I mean, and I think it's important that we be smart because, while there may be need across the country in lots of different locations, strategically, we want to focus where the biggest needs are. And that's both in a positive and a negative. For instance, in California, I understand that they're having a lot more success at the state level exchanges and that they've done a good job. We want to continue to promote that. But we also recognize that we need to be doing a lot of work in California because of the proportionality of Latinos who live in that state. So states like California, Texas, and Florida obviously become increasingly important because of the proportion and the number of who live in those states. But we want to support the successful efforts that are already occurring at the state level. But this is why we want to make sure folks who are going online or using other methods like the phone call, the call-in line are having success, and that they're getting information that they need even before they try to get online or even before they make the phone call. It might be helpful for them to talk to trusted partners, these promotoras de salud, the navigators, whatever you want to call them. There are going to be more and more folks that we're trying to make available to them so that they can have as much information when they do try to not only go online for the first time, but they may end up going online many times. As we've heard, people during other laws that were passed, which one was it? The Massachusetts law, which was really the first law that passed something like this, people would go online 15 to 20 times. And so for us, yes, we're eager for them to get online that one time, but it's not just about the one time. It's making sure that they have all the information they need so that the different times they go on and when they make their final decision, they're fully informed and educated.
I think one thing to know is the importance of healthcare insurance is that you just don't make a decision overnight. So you need to get the information, the forms, which is only a 3-page form now for all the health insurance to the marketplaces. You need to submit it and then talk to the people, the counselors, the promotoras, about your own individual situation. And a lot of the affordability is going to come based on your own income. And the tax credits and the subsidies that are going to happen to our community is going to depend on the applying for taxes and getting those credits in January if they apply by December 15th. And I just want to mention that December 15th is probably the next biggest date to think about, because if people enroll in an insurance plan through the marketplace by December 15th, they will be able to have insurance, this affordable insurance, by January 1st. And people need to have insurance next year or they will get a fine on their income tax. And we also need to let people know about that in our communities, because many of our communities are working, and we want them to know the option. They buy insurance just like they buy car insurance, or if they don't, they'll have a penalty. Anyway, there's a lot of other details I don't want to get into, but I just wanted to say that since you asked about dates. So we're very encouraged by all the organizations getting the word out to our community to please look into their own insurance options for them and their families.
And I just wanted to underscore what Brent and Maria Teresa were also talking about, which is this is really an on-the-ground effort for us, and we are really emphasizing the one-on-one work to do the outreach and let folks know and educate them about the marketplace. So we're really doing a lot of cafecitos, we're doing a lot of those kinds of one-on-ones, and we're working with promotoras and those who are counselors and patient navigators. So that's where we are really focusing our efforts on. We are also recognizing that we reach out to a lot of young women. So we're doing a lot of social media in that way, and we are pointing to the fact that you can download the application, and the application is available both in English and in Spanish, so you can actually download that in those both languages. So that is what we really are focusing on, and we're focusing on what's happening at the local level and emphasizing those states. So that's what we're doing in those areas where we already have existing networks.
Gracias. With that, I want to make sure that we have time for one-on-one interviews. I see one more question, and then we move to the one-on-ones. I want to make sure that all of you have time with all the leaders over here. Last question.
El impacto del cierre, del shutdown, en cuanto a los recursos que han recibido y el mensaje de los indocumentados, ¿no? Que son millones, que no tienen acceso a esta ley, ¿no?
Bueno, el tema de nuestros hermanos y hermanas indocumentados es un tema que sigue en la mesa. Nosotros como coalición peleamos fuertemente durante las negociaciones para que se incluyera algún elemento para que nuestros colegas indocumentados pudieran entrar en el aspecto del intercambio, que es un elemento básico de justicia, que puedan comprar un seguro con su propio dinero. Desafortunadamente todavía no estamos ahí en este elemento, vamos a seguir luchando como coalición, pero es un tema que todavía desafortunadamente sigue en la mesa, pero eso es un tema muy importante que todavía tenemos que seguir analizando y trabajando.
El cierre del gobierno en cuanto a los recursos, el dinero, ¿se perjudicaron ustedes en cuanto a educar a la comunidad?
Bueno, yo creo que juegos políticos como lo que se dio con el cierre del gobierno afectan al país en general, y obviamente tuvo un impacto serio en nuestra comunidad. Muchos de los servicios y de los programas de los cuales nuestra comunidad se ve beneficiada directamente y de los cuales trabajamos muy cercanamente se vieron afectados. No podemos dejar que juegos y caprichos políticos afecten el futuro de la nación. Esto es la ley de la nación, ya fue ratificado en una elección presidencial, fue ratificado por la Suprema Corte, ya no podemos jugar juegos políticos ni entrar en caprichos políticos. Debemos de enfocarnos en seguir con propuestas sólidas para la economía y en la implementación del cuidado de salud. With that, I want to thank everybody. Our leaders are going to be available for a one-on-one interviews, and we look forward to collaborating with all of you. Muchas gracias.